Hello, this is Belay with OrthoVirginia here at Fair Oaks, specializing in joint replacement surgery. Today I thought I would show a few examples of what hip osteoarthritis looks like. This is a normal hip. It's a ball and socket joint, so that consists of the femoral head and the acetabulum, the socket. You can see that this blue surface acts like the cartilage, so this acts to protect the joint from pressures as you walk. Over time, you can have injuries to these surfaces. You can get cracks or breaks in the cartilage, which cause pain, swelling, and may even cause a limp. Over time, this arthritis can progress to a severe stage where you have bone-on-bone apposition between the two bones. They're contacting each other at all times when you're laying down, when you're standing, or walking. One option, if non-operative treatment fails to improve your symptoms for hip osteoarthritis, is a hip replacement. What that looks like is we replace the ball, your arthritic femoral head, with a new surface and a new surface on the acetabulum. This allows these two parts to come into contact very smoothly and glide, which allows you to have a pain-free range of motion and return to your activities without any restriction.